When you step onto an airplane, the polished surfaces, soft lighting, and orderly rows of seats create an immediate impression of cleanliness. It's easy to feel reassured by the spotless windows and the fresh scent in the cabin, as if every detail has been meticulously sanitized just for you. Yet appearances can be deceiving. Research shows that the cleanest-looking places often conceal the highest concentrations of germs. In fact, the very tray table where you place your meal or rest your phone can harbor more bacteria than a subway pole during rush hour. This contrast between what we see and what actually exists highlights a hidden truth about air travel. The illusion of cleanliness does not always guarantee true hygiene. The question of whether airlines are dirtier than subway trains is more complicated than it first appears. At a glance, airplanes often seem spotless, with polished surfaces and orderly cabins, while subways are notorious for their gritty, well-worn appearance. However, looks can be deceiving. When we dig deeper, we find that the environments differ not only in how they are cleaned, but also in the types of germs and bacteria that thrive on their surfaces. Factors such as air filtration systems, cleaning protocols, and the sheer number of touch points all play a role. This comparison reveals surprising truths about hygiene and safety in both modes of transportation, challenging our assumptions about what truly makes a space clean or dirty. At first glance, subway stations and airplanes offer starkly different impressions. Subways often appear grimy, with visible dirt, worn surfaces, and the unmistakable scent of a well-used public space. In contrast, airplane cabins are designed to look pristine. Gleaming surfaces, soft lighting, and orderly rows of seats create an illusion of cleanliness. However, appearances can be deceiving. While subways may look dirtier, their obvious grime prompts regular cleaning and lower expectations. Airplanes, on the other hand, may hide significant bacterial contamination beneath their polished exteriors, especially on high-touch surfaces like tray tables and seat pockets. This contrast reminds us that true hygiene isn't always visible, and that trusting appearances alone can be misleading when it comes to our health. When comparing air travel to subway journeys, the number of surfaces passengers interact with on airplanes is significantly higher. From check-in kiosks and escalator handrails to tray tables, seat pockets, and armrests, each touchpoint presents an opportunity for bacteria to accumulate. Unlike subways, where passengers typically touch only a few major surfaces like poles and seats for short periods, airplane passengers remain in close contact with their surroundings for hours. Studies have shown that certain airplane surfaces, such as tray tables, can harbor much more bacteria than even the flush buttons in airplane bathrooms. The extended duration of contact, combined with limited deep cleaning between flights, allows microbes to persist and multiply. As a result, airplanes often have higher levels of surface bacteria than subways, despite their clean appearance. Among all the surfaces you encounter on an airplane, the tray table stands out as the dirtiest. Research has revealed that these seemingly innocuous tables can harbor far more bacteria than even the flush buttons in airplane bathrooms. In fact, studies commissioned by aviation authorities have found that E. coli and other microbes can survive on tray tables for up to 72 hours, making them a persistent hotspot for contamination. The reason is simple. While bathrooms are cleaned frequently due to their obvious association with germs, tray tables often receive only a quick wipe, if any, between flights. Passengers use them for eating, working, and even changing diapers, further increasing the risk of bacterial buildup. This makes the tray table a critical area for mindful hygiene during air travel. When it comes to surface contact, the differences between subways and airplanes are striking. On a subway, passengers typically interact with a handful of surfaces, like poles, seats, and doors, and their contact is brief, often lasting only a few minutes. In contrast, an airline journey involves touching a wide array of surfaces, from check-in kiosks and armrests to tray tables and seatbelts, many of which are used repeatedly throughout a flight. The closed environment of an airplane means travelers remain in prolonged contact with these surfaces for hours, significantly increasing the opportunity for germs to transfer. Studies have shown that airplane tray tables, for example, can harbor far more bacteria than even the flush button in the lavatory. While subways may appear dirtier, the quick turnover and limited touch points mean less sustained exposure. Ultimately, it's the extended and repeated contact with surfaces in planes that elevates the risk of germ transmission compared to the fleeting interactions typical of subway travel. When it comes to air quality, airplanes and subways are worlds apart. Modern aircraft are equipped with advanced HEPA filtration systems that continuously refresh the cabin air every 2 to 3 minutes, removing over 99% of airborne particles, including bacteria and viruses. This means the air you breathe on a plane is often cleaner than what you'd find in many offices or even some hospital areas. In contrast, subway trains lack such sophisticated filtration. Their air is subject to frequent changes as doors open and close, allowing dust, debris, and outdoor pollutants to circulate freely. The result is a less controlled environment where airborne particles can linger. So, while airplane surfaces may harbor germs, the air itself is remarkably clean compared to the bustling, dust-filled atmosphere of a subway car. Airplanes present a unique paradox when it comes to cleanliness. Thanks to advanced HEPA filtration systems, the air inside a plane is actually refreshed every 2 to 3 minutes, making it cleaner than the air in most offices, homes, or even some hospital areas. However, while the air is remarkably pure, the surfaces passengers touch, like tray tables, armrests, and seatbelts, often harbor far more bacteria and viruses than those found on public transit systems. In contrast, subway trains have less controlled air quality, with doors opening frequently and no specialized filtration, resulting in higher airborne particles and dust. Yet subway surfaces tend to accumulate less long-lasting contamination, as passengers interact with them for shorter periods and cleaning crews often wipe down high-touch areas multiple times a day. So, while you may breathe easier on a plane, the surfaces you touch can be far riskier than those on a subway. This contrast highlights the importance of understanding not just what looks clean, but what truly is clean beneath the surface. Airplanes are meticulously designed to evoke a sense of cleanliness and order. Smooth surfaces, soft lighting, and uniformed staff all contribute to an environment that feels sterile and safe. This visual impression can lull passengers into believing that the cabin is free from germs, even when research shows otherwise. In contrast, subways make no attempt to disguise their gritty reality. Exposed metal, worn seats, and visible grime reinforce the expectation that these spaces are dirty. Yet appearances can be deceiving. While subways may look unclean, their surfaces are often cleaned more frequently than those on airplanes. The psychology of cleanliness teaches us that trust in appearances can lead to complacency, making it crucial to look beyond design and remain mindful of actual hygiene practices. Airplanes contain several hidden germ zones that often go unnoticed by travelers. The seat pocket, for example, is a repository for used tissues, food wrappers, and other debris, making it one of the dirtiest spots in the cabin. Tray tables are frequently touched and used for eating, working, or even changing babies, yet they are rarely disinfected between flights. Air vents, armrests, and seatbelts also accumulate microbes as they are handled by countless passengers and are difficult to clean thoroughly. In contrast, subways have fewer major touch points, primarily poles, seats, and doors, which are exposed to rapid passenger turnover and are often cleaned more regularly. While subway surfaces may appear dirtier, airplane surfaces can harbor bacteria for longer periods due to prolonged contact and less frequent deep cleaning. This comparison highlights that the most concerning germ zones in airplanes are not always the most obvious, and they differ significantly from those found in subways. It may come as a surprise, but airplane bathrooms are actually cleaned more frequently than most other surfaces in the cabin. Airlines recognize that passengers are quick to notice and complain about dirty restrooms, so cleaning crews prioritize these spaces during quick turnarounds. In contrast, subway bathrooms, when they exist, are often neglected and rarely cleaned throughout the day. This means that, despite their reputation, airplane bathrooms can be more hygienic than the tray tables or seat pockets just a few feet away. Meanwhile, subway restrooms tend to accumulate grime and bacteria, making them some of the least sanitary spots in public transit. This paradox highlights how our assumptions about cleanliness can be misleading and why it's important to look beyond appearances when considering hygiene during travel. When it comes to cleaning protocols, there are notable differences between subways and airplanes. Subways typically undergo nightly disinfecting, daily wipe-downs, and periodic deep cleaning, with some cities even mandating high-pressure washing during outbreaks. In contrast, airplanes often have only 8 to 15 minutes between flights for cleaning crews to remove trash and address visible spills, leaving little time for thorough sanitization. Deep cleaning on planes is usually scheduled just once every few weeks or months, and high-traffic routes may receive even less attention due to tight turnaround schedules. This means that the seat you occupy on a flight might not have been deeply cleaned for an extended period, increasing the risk of lingering bacteria and viruses on high-touch surfaces. While airlines focus on maintaining a clean appearance, the reality is that microscopic cleanliness can be overlooked, especially during busy travel periods. Closed environments like airplanes create unique challenges for germ transmission. Unlike subways, which benefit from frequent ventilation as doors open and close, airplanes are sealed for the duration of the flight, limiting the natural exchange of air and increasing the risk of surface contamination. While modern aircraft use advanced HEPA filtration systems to keep airborne particles in check, germs that settle on surfaces such as tray tables, armrests, and seatbelts can persist for hours or even days. Passengers spend extended periods in close proximity, repeatedly touching the same surfaces, which amplifies the potential for illness to spread through contact. This cycle of touching contaminated surfaces and then one's face or food is a primary reason why infections can move quickly among travelers in these enclosed spaces. In contrast, the rapid turnover and open nature of subways mean that while surfaces may appear dirty, the risk of prolonged exposure to the same germs is lower. Ultimately, the closed design of airplanes makes mindful hygiene practices especially important for reducing the spread of illness. Research has revealed that airplane surfaces, particularly high-touch areas, often harbor more bacteria per square inch than those found on subway trains. Tray tables, seat pockets, and armrests on planes are among the most contaminated spots, sometimes carrying significantly higher bacterial loads than even the flush buttons in airplane bathrooms. This is largely due to the limited time crews have to clean between flights, which often prioritizes visible tidiness over thorough disinfection. In contrast, subway surfaces, while appearing dirtier, tend to have less prolonged contact and are cleaned more frequently in some cities. These findings challenge the common perception that airplanes are inherently cleaner than public transit systems. Ultimately, the invisible presence of bacteria on airplane surfaces underscores the importance of mindful hygiene practices while traveling. When comparing airlines and subways, the answer to which is dirtier isn't as straightforward as it may seem. Airplanes typically have much cleaner air than subways, thanks to advanced HEPA filtration systems that refresh cabin air every few minutes. However, the surfaces inside airplanes, like tray tables, seat pockets, and armrests, often harbor more bacteria per square inch than those found on subway trains. Subways, while they may appear dirtier due to visible grime and frequent passenger turnover, actually have fewer high-contact surfaces that are used for extended periods. In contrast, airline passengers remain in close contact with the same surfaces for hours, increasing the risk of germ transmission. So, while you may breathe easier on a plane, you're likely to encounter more bacteria through touch than you would on a subway. Ultimately, cleanliness depends on what you measure, air quality or surface hygiene. To ensure a safer and more comfortable journey, travelers can adopt a few simple hygiene practices while flying. Before settling in, it's wise to wipe down high-touch surfaces such as tray tables and armrests with disinfectant wipes, as these areas can harbor bacteria for extended periods. Regular hand hygiene is essential, Washing hands with soap and water or using hand sanitizer, especially before eating, helps reduce the risk of illness. Avoid placing personal items directly on tray tables or in seat pockets, since these spots are rarely thoroughly cleaned between flights. By staying mindful of these habits, passengers can minimize exposure to germs and enjoy greater peace of mind throughout their trip. As we navigate the complexities of modern travel, it becomes clear that appearances can be deceiving. True safety lies not just in what we see, but in what we know and how we act. By staying informed about hidden risks and adopting mindful habits, we empower ourselves to make choices that protect our health and enhance our comfort. Whether on a plane or a subway, understanding the realities behind the surfaces we touch allows us to travel with greater confidence. Ultimately, knowledge and mindfulness are our best companions, guiding us towards safer and more rewarding journeys wherever we go.